All right. Good evening, good morning, good afternoon, wherever you are, everyone. Welcome to another session of IOTTT's Saturday night chat. So, again, the premise of this initiative is everything starts with a discussion. Today, we are in for discussing yet another important topic, geographical distribution of occupational therapists in India. As we all know, OT is a critical service that helps people whatever they want and need to do. So, of course, there's a lot of people who might benefit from OT. And in a country like India, like ours, like people, we are, of course, hugely populated and people everywhere. And a lot of people do live in rural and remote parts of the country as well, and of course, to make our service more accessible, OTs need to be in all over the place, and in the sense, like in all parts of the country, we need to have service coverage in all parts of the country. But is it happening? And unfortunately, of course, it's been a while since I conducted a workforce survey in India. It's been like what five years now. But like until that point, what I observed in my research, in a couple of studies that I've done, looking at the geographical distribution of India or workforce in India, we have pockets of OTs in major cities or major areas, and especially wherever the schools are, like Mumbai, Chennai, Delhi. That's where the OTs are really concentrated. And then as we move away from those cities, even some of the major cities had single digit occupational therapists. So that's what we are going to discuss is how does the geographical distribution of OTs look like currently? Like some of you are in India may share your point of views, and also like what can we do to promote the diversify the geographical distribution, whereby we are encouraging OTs to work in all parts of the country, or how can we extend our services? Even the therapists have to go to, if he or she is not willing to go to that part of the country, but still with the tele-rehab and other channels, how can we promote accessibility of the services as well? So that's what we're going to discuss. Without further ado, today our moderator is Dr. Naresh Babu Karnakaran, who's currently pursuing PhD, at the Santosh University in Ghaziabad. Also, he has been a clinician, academician, wears multiple hats. So, Dr. Naresh Babu, please take over.
Yeah, thank you, Karthi. So, today's topic is on geographical distribution of occupational therapists available in India. Hopefully, I will just give a little glimpses about it. Some of the places we can able to separate like north, east, west, and south. So, the most predominantly we have occupational therapists available in New Delhi, Kolkata, Mumbai, and Tamil Nadu, and also in some central parts of our India like Madhya Pradesh and even in Bihar and even other places. But they are actually merged and they also participate as when we are having an occupational therapy association conferences, and even in some of the places with academic colleges are available. So a lot more are still needed in many parts of the places. So as you know that our occupational therapy needs a very vital component in our healthcare benefits. But as according to Dr. Suresh Kamalakanan sir, he has actually done a review on effectiveness of occupational therapy intervention to reduce disabilities in person with disabilities in India and many parts of the places. He have collected a lot of information that how the people are working towards it. But actually, the rural parts of the country, which still needs seeks our professional expert, but it is not true that they are not available. Actually, most of the occupational therapists they are merged in the rural areas as well, but not in the identification of OT, but as an identification of a different perspectives, like a teacher or like a kind of a, other moderates. So they try to provide it, but not in the basic of as an occupational therapy. So still they are actually working on whether voluntarily or whether doing some mere benefits. So still available, but they are not coming into the limelights because they are not available in the cities, which we need to be integrated through our associations. So in recent years, OT has gained recognition and prominence in India's healthcare landscape. Even some of the insurance companies have started reimbursing some of our therapy sessions work. And even there is an RBSK project which are also supporting us to provide the reimbursement for our work. So that is been considered over recent years. And there are some of our other distribution centers. Mostly, I said that higher density population have occupational therapy services, which is merged sometimes with physical therapy as well. So most of the places actually they're still being called as a physical therapist rather than occupational therapist. That needs to be addressed. Might it will change a lot after a National Commission for Allied Health Professional Council exists. So while some states, regions may have more established presence of OT centers, others may lack sufficient resources or trained professionals to meet the demand for services. So I have put some of the branches which are still continuously working for the development of our profession, even in the rural areas as well. And the most important part I will be supporting, I will be part of it, some of the places like community reach centers. I used to go and give consultations and even provide some kind of a work without doing any media coverage or promotional work or any monetary benefits. We try to gather information and we try to provide at the collective places. So it's still happening through the branches, and I think now South India has taken over a lot in the official, and they are trying to support and they are trying to take over the lead through the associations. So some of the factors which can be influenced in distributing this factor. Uh, just a second, I will admit some of the people. So some of the factors like the healthcare infrastructure, government policies, and funding allocations, and also the influence the distribution of OT services are very much limited. Now, the research also emerging a lot. The research funds are related to autism and other conditions has gained a lot of boom for the occupational therapy. After COVID, they faced a lot of discrepancy, but now it has been booming up, providing more colleges, emerging of lot more centers and lot more awareness in the south side is contributing for the north side as well. Challenges and opportunities, what we usually get it is challenges to equal distribution is still not much. Actually, when they are getting married towards to a particular place and they were supposed to be in the rural areas, then they try to contribute in some of the small centers. But if they are getting a mere amount of benefits, then they doesn't want to continue into the centers. But still, actually, for my experience, I have started working with a one particular center in Ballari, which is actually started by politicians over there. They contribute some of the places to start the center because the other specialties are not available. They are supposed to go to Hyderabad or Bangalore to avail the services. To for reducing the cost and for or seeking those peoples to be in a one collective place at one particular rural areas, we have started that center. But still, we need the monetary benefits to support them and they are ready to accept, but still contributing for some of the places like Vijayanagara Institute of Medical Sciences and other places, still lacking of occupational therapists. They are not ready to join and work for the mere benefits. Still, when we are trying to, even though the population of disability is higher in those places. And the geographical distribution, which is actually the recommendation which I used to give, is expanding the training opportunities for professionals, particularly in the rural areas where there is a critical shortage of practitioners. And I think Dr. Kathi's work like tele-rehabilitation and other works will emerge now. Assistive technologies and artificial intelligence plays a major role, but still the professionals' need is always existing in the rural areas. So the major public awareness, that's why this particular Saturday night chat is more required to make the awareness and create a lot more educational campaigns and community outreach centers towards to the public. Thank you very much.
All right. So, do you have some guiding questions, Naresh? Thank you. Thank you for the brief backdrop of the today's topic. So, do you
Yeah.
have any guiding questions that you want to use to?
No, whatever is emerging through the presenters, then we will be able
Okay.
to continue
All
that.
right then. So, like, how about we, like, how many of you have had an opportunity in India to deliver service to some suburban and rural and remote areas, like in terms of OT services through some project, campaign, CBR, whatever it may be. But if all of us could take some time to discuss, like in our own experience of providing services to a geographically distant remote area in India. So let me start because I proposed the thought. So I think, during my internships and all, like with Vellore and Karigiri, there were some like Shanti Nilayam villages, and there were some, like, where we went for CBR on a 1 day field trip, where we went to some remote villages and assessed the people and gave them some home modifications and solutions. So that's kind of like, still I remember those experiences. So that is one opportunity for me to get to a remote area, in a village in Tamil Nadu, and then deliver occupational therapy services. And then, while I was in India, like I was associated in several, NGOs and stuff, and through that I've done some initiatives that influenced some remote people. Say, for example, a disability home in outskirts, very much outskirts of Chennai back then, where nobody, it's in a very isolated place, and I've been there as a consultant a few times a month, and provided train the teachers over there to help the children with disability. So some sort of indirect influences. But if you ask my primary practice throughout those time frame I was in India after my graduation, it was completely like, city based in Chennai. And rightfully so, that's where we get reimbursed, that's where we find opportunities and all those things. But having said that, this is an issue not only we as in the field of OT are facing throughout the healthcare field. If you really look at it, even the physicians, like, medical college students, recently we heard there was some sort of a lawsuit filed by a bunch of medical students saying that, we don't want to be posted in the remote area. But again, like throughout the world also, when I examine the literature, this has been used as a strategies where, like, for internships, for medical rotations, if we post the students for X amount of time, 6 months or a year, whatever it is, at least that time the local people in that area are getting access to the services, and thereby these students also like start feeling like, they're being sensitized to the needs in the rural remote areas. But again, a lot of these countries are using this stopgap measures, like incentivizing practitioners or giving them a little bit more incentives if they chose to work in the rural area or remote area, or forcing them, like, after you graduate, if you're graduating from one of the government institution, then you're obligated to the government to at least serve 3 years in the remote area. So there are several strategies. There is a pros and cons for everything. There is always a pushback for all these strategies. So yeah, I'll stop here, but, like, when we talk about strategies, I will elaborate on these points. But now I want to hear from others here to
But
share
even
about their experience of providing services in rural and remote parts of India.
when actually we had a meeting for principals by Dr. MGR Medical University register, there was a one agent, like he is an NGO. So they approached to the Tamil Nadu MGR Medical University to avail the occupational therapy students for their rural area network. So they were asking for them to provide them. It's not the internship students. They were asking even for the clinical postings at the third year, so that they can come and work for us without any benefits. So, which actually it is a very difficult. Even we are likely to send our students, but our management will not be happy to send those students to the other places, because every management needs our students for their own services, because we have our own hospitals, we have our
Yeah.
own community outreach programs, and why to send? And even though it is for their benefits, actually their project, and they are having some fund behind it, and they can't able to afford for occupational therapists at present. So they openly said that we couldn't able to afford. So at least you train those peoples, and your students can able to be supportive. Anyway, they are we can't able to pay for them because they are still in the second year or third year. So we'll get the manpower. At least they have a basic knowledge about occupational therapy, and we can benefit out of it. And the assessments can be done by the professionals, which they have it at least one or two in the zones. Even we have in Chennai, we have zone 1, zone 2, zone 3, like that. for a special educators, they have placed these zones, and even for other people for serving the disabled into the rural area and even to their homes as well. But that is that actually that got failure because it is doesn't have any win-win situation for the management as well as for the NGO, so they couldn't come up again. But for the tele rehabilitation, they were trying to make a kind of an app like how Amar Seva Sangam has created an early intervention VIAPT app where they can go there and those professionals work over with the child and the same location and everything, all goal sets, everything will be shared in the digital area where no other manipulation can be done. And that app actually got a lot of awards for creating an extensive awareness. But we are not making sure whether those are real professionals. They might be some trained persons, but not like a real specialist or anybody which they are reaching to the place and providing the therapy services. Uh, so this is what my experience I faced it. Any
Well,
others?
I couldn't agree more than what Karthik and Naresh has just mentioned about the services in community. I mean, like, in the rural areas in India. And I suppose, as Karthik mentioned, it's a global issue, and I see the pattern all over the world. Even countries like Ireland and US and Canada, I suppose, like it's the same. People more tend to practice in the cities than the rural areas. However, there are lots of strategies upcoming, which is a little bit of pleasing, especially after the COVID. Like the telepractice is booming. Well, I wouldn't say booming, but like it's emerging in some parts of the country. And if you're lucky enough to have a person to set up the initial services, and I think in the and then it just kind of roll on later stages, which I experienced during the COVID time. There were a couple of clients approached from a very rural part of Tamil Nadu, and they were so willing to continue the therapy services online. Um, I suppose this could happen after the digital area developed a lot in India. So when we think about in the past, like when we graduated, when we did the community-based rehabilitation, that time it wasn't there. Like we probably would have gone and did our bits and pieces and came back, and there wasn't any much follow up. However, now this huge opportunities, especially for young occupational therapists who really want to explore different experiences to add on into their CV. I think it's a really good area that they could look. I mean, they could still live in the city, but elaborate, develop their telepractice, targeting the service users in the rural area. I think that probably when it comes to strategy, we can discuss that more. But I suppose it's a global issue, Karthik, and it's a very interesting topic that we are discussing. And we really need something to be, initiate uh, to address the problem. Thank you.
Okay.
Yeah, just in my point of view, yeah, thanks for sharing your work experience in the beginning of your careers. I worked in Tiruvannamalai in Tamil Nadu, and that's where I kind of worked in a two different kind of areas. One is the special school, kind of school based, and the other one is the community based rehabilitation. So it's actually part of the national program for person with disability. So they implemented in Tirunelveli district, and we kind of coordinated between different NGOs in a different block in the Tirunelveli district. So
Mm-hmm.
we did the awareness program through the, so we kind of recruit volunteers from each village. So they performed kind of like work, like they surveyed house to house, and they surveyed for disabled people, and so we kind of created awareness and given them kind of entitlement from government and the other things. So and then that kind of rolled on to do kind of satellite center for the special school, and also kind of the politicians and the village heads kind of came in on board, and they actually provided some of the equipments like kind of wheelchair and different mobility equipments. Those they donated. So that's where I kind of worked before I came to Ireland. So that's kind of my, yeah.
Thank you for sharing. We are going to really, yeah, that's something to discuss. The community model that you just said. I think to make any services sustainable, especially in a country like India, I think we need to come up with the innovative, solution-based or problem-oriented models. Because, like, if you really go try to place the Western model in a context like India, it really demands a lot of resources and infrastructure, which is a difficulty in some parts of India. All right. Thank you. Next, Kavita, would you like to share your experience?
Yeah, sir. Sir, I have started teletherapy during the COVID period,
Mhm.
but there was not that much awareness, and people are not willing to join for the teletherapy actually because they were not aware of the therapy. How they actually wonder how the therapy is working, like how it will work for them. So I need to convince them. And there is a like people was thinking like how occupational therapy is possible through online, and how the people will how the therapist will treat the patients without seeing, without touching them and all. So I need to educate the parents. And as today's topic, like geographical distribution of occupational therapy. So like most of the clients, like few clients I took from the remote area, they have approached me through WhatsApp groups and through social media. And they were like they don't have there is a lot of language barrier also, because they are coming from different location, Pune, interior of Maharashtra, interior of Pune and all. But I also don't know Hindi, and the people who come to me doesn't know Tamil, English or anything. So we need some moderators. And the people who approached me, they took some person, like some of their relatives, and they approached me. I have educated the person, and I have told some home programs. I showed some videos, and through that I have trained the parents to do therapy through online, through Google Meet, or through Zoom Meet, or through Zoom, like that. So it's working like that. So um, it is like teletherapy is much working nowadays, but earlier it was very difficult for me also to develop like to what to say, to create awareness about the occupational therapy through the like
Tell me, have
through
you?
online. Yeah. Even my one of my old manager, like I was worked in a clinic in Bangalore. He was asking me how it is possible that you are doing through online. Is it possible now? Like I then started explaining them. So teletherapy is working now. We can reach to the rural area also without moving from our place, and with our comfortability. And the people we can, what the therapist is thinking, like we should not teach the techniques or any exercises to the parents, because they doesn't know how they will do. But what I will do is like showing videos, giving some models, showing some models. With that, we can able to reach the goal. We can able to train the parents to do the therapist, or attenders to do the therapy. So in that way, it is helpful because it is educating the attenders and as well as family members, as well as it benefits the client also. So teletherapy is the one way which is good now, slightly picking up. Even abroad clients, they can able to easily approach, but in rural areas they doesn't know the technical terms. They were not much aware of the things like what we are using. WhatsApp, only WhatsApp they can able to access easily, apart from Google Meet or Zoom or other things. But that is working well actually. And Karthik sir told me like we have to initiate from the college itself. It is a good idea actually, sir. Like we can make a point like every student should do at least a few weeks of posting in a rural area to complete their like internship. What we did like in our internship also we have the community based rehabilitation like that. So we have moved to rural areas. We do surveys. We meet very many people. We educate the parents or we educate the general public about the awareness. Like for example, joint protection techniques, and based on that, we will first do the survey and we will start explaining the technique to the general public. You can do this, that, and all based on their needs. So we can try that again with the college level. So if we start like that, then it will be more beneficial to the general public to create awareness about the occupational therapy. I'm agree with your points, sir. Like what you told is good idea.
Thank
And
you.
teletherapy is also working well now, so we have to improve, but not much therapists involving in teletherapy actually. Only few therapists are trying to do online, and that too, like in specific area, only pediatric, only in specific areas like adult rehab or pediatric rehab. We have to focus in all areas. Not on. We should not restrict our um, major client client resources like.
Got it. Thank you.
Thank you. Thank you.
One more point, sir. We can try to like even we are working in a clinic also. We can try teletherapy, and through workshops, webinars, we can conduct in free of cost to make the public awareness. That
Mhm.
also we can try.
I think before we proceed with those teletherapy points, we need to form a guidelines for teletherapy services as well, because we always accommodate the Western countries' policies and guidelines. Sometimes it won't applicable in our country, so we can able to publish an article related to the teletherapy, the services which can be provided on the basis of some kind of a guidelines and rules and regulations to be followed by even by other professionals when we are recording and sending some of the important points which can't be applicable for all the clients. So that policies, when we have it in our hand, then we try to provide these services. It will be more useful, because sometimes it's okay, we are providing some guideline or therapies, tips and strategies towards to the WhatsApp group or other social media platform. But later on, it will be reversible, because if happens something different or any kind of negative patterns, then we need to protect by ourselves by having our guidelines. So that is more needed before we support. Anyway, the COVID time, it helped a lot for us to do it, because the not such guidelines or not such kind of an approach is existed. So that actually created an welcoming opportunity for us to provide the disseminated. Even we still think about the transdisciplinary approach, which was trying to emerge during that time. So now this is more needed, as we can have it as a guidelines in the later time for the teletherapy services in India.
Yeah, sure, sir. That what you told is right. We have to create a list of things what we have to do and what we should not do, and it is good for both therapists and as well as for clients. And yeah, sir, it's true. We have to do it.
Yeah, I see Shauda ma'am's hand. Go ahead, ma'am.
Yeah, just being mindful on this topic. Teletherapy is one of the strategies I think we should, look into how we address the current issue of, having OT services in the rural area. That's a very good discussion that we had, and we could, in fact, have that as a individual topic itself in later sessions. Coming back to the topic, I think from for a permanent solution, I mean, teletherapy is one of the strategies, and that's definitely not going to be the key thing for to cover the entire population, especially in a country like India. I think as OT, we really need to look at the broad picture of how to approach the government sectors, the health, the primary care health centers in the rural areas, and how could we collaborate with the education systems like the universities who develop, who train occupational therapists, and how we could actually link these organizations and the primary care health centers and people like us from, for example, from IOTTT or the All India Occupational Therapy Association, so how we could have a collaboration between these different organizations to develop a permanent solution for for filling the gap of having OT services in rural area. I think that's a key thing that we really need to step in from an association ourselves. How we go further, that I'm quite interested about to know how we could go, and people could share your thoughts.
Got it. Before I answer, I mean, like, comment on the lead that you provided. Couple of things related to what Kavita has said is one. Of course, not everything in occupational therapy can be done through telerehab. So telerehab has its own limitations, right? Anything that requires physical contact cannot be delivered through telerehab. And telerehab is an opportunity to increase the accessibility of the services, but that doesn't really cut down the need for the geographical mobility of the occupational therapist per se. So we still need, because we need to understand the benefits and the advantages of teletherapy or telerehab, while also like underscoring the disadvantages and challenges it might create as well. It's very fortunate that now the technology is widely available and the awareness of telerehab is increasing, and through that platform a lot of people are getting benefits, and we continue to need to focus on that area. There is no doubt about it. We need to do more. On the point that Naresh made about having a guidelines during COVID, IOTTT in fact published telerehab guidelines, which is still available widely publicly to everyone who is interested in reviewing that. If you go to the IOTT's blog or to the website and click under the resources, it will take you to the blog where it's housed. So it's still available, just FYI. Of course, like when I kind of reflected on this issue of global distribution of occupational therapists, or like countrywide distribution of occupational therapists within India. Of course, like the first thing, based on my research, one trend that emerged was wherever the institutions are, that's where the OTs are concentrated, right? So if you have starting, if you start OT colleges in different parts of India, like a couple of colleges in the northeast, and like two in Odisha, and like two in like some outs, there are now emerging colleges have emerged in Kerala. For a long time there was no OT college in Kerala, right? So and that when I did the survey and all, I was surprised to learn, like even in like states like Andhra Pradesh and all, there were only very few OTs reported they were from that area. So again, like there is a word of caution here. It may be the inability of the survey to penetrate to wherever the OTs are, right? Probably like the medium through which we share the surveys, or like pocketed in that area, and only they responded. So it may be the limitation of the survey than the actual representation, but to an extent we can rely on that. But it still gives us a glimpse of the volume of OTs are more in cities like Chennai, Mumbai, and but there are other major cities in India equally big cities, but they don't really have that many OTs. And the biggest difference is the number, the OT colleges are in these cities, right? So that there's some sort of attraction, and that kind of really like provides more concentration and visibility of services in that part of the country. So I think the one of the strategies could be like when we approve colleges from the government agencies, like when the universities approve OT institutions to affiliate OT institutions, they need to make sure that they are geographically x distance apart, which means like then this is a hub for this locality and this institution should be at least away from, so they are not serving the same population, that we are extending the reach of the services as also availability of OTs. So that may be one strategy. And also the second thing is, like again, this strategy, despite the pushback, has been implemented in many countries, is obviously having a x amount of time in a rural posting. Like no matter what, if you want to graduate, then part of your internship should be in a so-called identified rural or remote areas, and you need to go through that as part of your graduation requirement, because that way we are sensitizing that person through the need in the rural services. And meanwhile, as long as we find a sustainable model, like we have say 6 institutions in the particular state or particular geographical area, and then they have like 75 villages or something, and they just kind of make sure that found some sort of a sustainable model. So throughout the year, except like some holidays and stuff, but throughout the year there is some place for the students to come back and rotate. So some college A covers the January February, and then the college B comes and covers the March and April. So the phases will change, but the services provided are kind of sustainable. Only we need some administrative people to make sure the services are coordinated, but these providers can rotate off. So they did their part, they get their experience and walked away. So I think we need to think like that. And then the other thing is obviously, like this community based rehab model, the age old model might still work, but again, we really need to identify again a sustainable model, which funding with funding, that is the biggest challenge now. When a lot of CBR, there is a lot of foreign fundings available, project fundings, and some NGOs are really into it, utilizing the funding. They are doing whatever they can do. But I think we need to promote that kind of a model as well, like where in the cities and suburban areas we have a hub, but then like that hub is responsible for X number of villages, and they have a sustainable protocol in the sense, like periodically they will do this disability awareness survey, and then do some disability sensitivity workshops, and then identify the people with disability, kind of layer them into multiple levels, like in terms of severity of the disability, and then start providing, like okay, if we have X number of people with moderate level of disability, then we need this many satellite centers in that locality. Then how are we going to are we going to operate them once a week? If yes, then we don't have to have a therapist in that area, but like a therapist can travel that one day a week. Again, nowadays with all the infrastructures, with highways, with fast trains and everything, I know people who, like some time ago, people who lived in Melmarutur or something, or even like Acharapakkam, Kanjipuram, and then they come every single day to Chennai to work, because the electric trains connected them, and all they need to do was, like if a Chennai person needs to get to start to work 1 hour earlier because of the traffic, they just need to add another 30 or 45 minutes more to that travel schedule. That's it. So it is a little bit extra, but still it's very much doable. So I'm kind of thinking, with all this infrastructure development, it is still doable. But I think it is not like like Monday to Friday, morning to evening, a service in the rural. Like based on the need, we need to come up with the new models where the hub is in some suburban or main areas, but then these therapists get to go to remote area and provide then required services that one day a week or something, some sort of a weekly clinic and stuff. Having said that, when I ran my own private practice, there was this need in Kalpakam, the Anuman Nilayam, right, the Kalpakam plant. So there was some group of families have children with some challenges, and they need OTs, and they said, like, it's too far for us to come to Chennai for everything. Would you be able to do anything? So we started this weekly clinic idea back then, and it was very successful. So they come together within their own area. They found a space for me. They found a very big hall. And then what I did was, like, I had another friend and therapist who worked with me, and he had a car. So we kind of like gathered like some activity materials and everything. We put it in the trunk of the car. We drove every once a week, every day. Sorry, I mean once a week, and then we delivered the services. We have a strict schedule and everything, pre-planned. We have only one parent coordinator on that other end, and then we did the service like for 5 6 hours. All the children get the therapy, and then I came back next week. So this was we were able to do this for a long time until I relocated. I was able to run that satellite clinic as well, and that area, the people in that area got services, and I got more and more new consultation, and even I did some adult consultations based on once they know that I'm there. Then the people ask, can you also like do this, can so there is a need. But again, I'm not going to sit like every time, because I have my own practice in Chennai, but still I was able to cover that area geographically. So I think we need to come up with a profitable, sustainable model where we find win-win solutions. And I think that is a way to promote the geographical accessibility and mobility of OTs. Thank you. I think I took a bunch of time, but that's what I want to
Yes.
share.
Thank you.
Others, how do you think we can extend like, share your thoughts? Mr. Godandan, ma'am, Mrs. Shobana, please
Yeah,
give us your
I
thoughts in
think
terms of what else we can do.
yeah, the guidelines would be a good start. To proceed with the teletherapy. Like I do practice here as a private, see private patient in Ireland as well. So there's kind of so you have a code of ethics as we have for the IOTTT, and we have a core rule registration. It's a kind of statutory regulation, and then the AOTI would be the professional body, but it's not kind of mandatory, but it is kind of um you sign into the AOTI, and then you agree to abide by all the codes and contacts, and the same with the India. And the main reason for that, it's the sometime if a patient kind of raises any kind of allegations or any kind of the treatment, if they if the expectation is if there is a gap between the expectation of the patient and the therapist expectation what they can achieve, and that's where the conflict arises. And to resolve that conflict, so kind of we need to be proactive, and there needs to be, if one caught in the trouble, it's going to have a kind of impression on everybody in that, in the professional body. So in that case, maybe the insurance or some kind of, it's mainly for guiding other therapists. It's kind of a peer support to share the information between us, and we can proceed constructively, and also kind of manage the conflicts, and kind of if there is a threat coming up, so we could proceed as a team or a body forward.
Got it?
Right, sir.
Any
You talked about insurance. So I think some of the places it's reimbursements are happening, but still there is a one insurance-based companies are emerging for supporting our services as well. So it is coming up, but in other parts of the places also we need the support and fund for so that other parents can able to avail at the rural places as well. Any others?
Yeah, I like the idea of Karthik discussed about having the schools in different areas. I mean, not gathered in the same geographical area. That's a really good point. And I think in order to pursue further, I think someone need to be hear the voice of the people that they are looking for services in their places. And I think that's where we basically get stuck at the end of the day. Like, like we know the different ideas and strategies, so how to implement them is the big question mark. Like, I mean, you had wonderful thoughts there. I suppose if we could write that up and um, approach the concerned people in the top. Maybe just an initiative from IOTTT. I think that would be, you know, I mean, it's not like we just discuss and then end the topic.
Yeah.
It's something that we need to follow it up. Yeah, yeah.
Yeah, it's a valid point. Like, definitely we need to think of some actionable strategies and move forward this discussion. Again, government, definitely all the governments really want good healthcare services for the public, for the people, regardless of where they live. So that is a priority of any government. But I think that the resources, infrastructure, other things are the barriers. So we need to come up with sustainable models and solutions to overcome these barriers. I always see that in India, religion is a major driver for many things, right? Like, if you really look at a lot of these, how we like, education is valued throughout the country. Like, people value education, how it's kind of entrenched. Like, if you really look at the roots of them, religion was used as a driving tool, and the spaces, again, how it kind of entrenched into all parts of the thing, because a lot of these churches went into education and started Christian schools, and a lot of these Hindu organizations and Muslims organizations, they all started, and they, whatever the spaces they have for religious area, they contribute or donated, and that's how the education become widely available. So I thought, like, the healthcare is also a similar movement. Everybody want good healthcare services, regardless of their faith or religion. The government also wants to promote it. So, say for example, we have a lot of elders with back pain in India. There is no doubt about it, right? But how many of them are seeking OT services? Then my question is, like, okay, first of all, do they know OT can do something about it? Number two, if they are willing, how are they going to pay for it? Or is the OT willing to just kind of, again, we cannot expect an OT to go and like do free services all the time. So we need to come up with some sort of a model. Again, like, if like, the traditional model would be one-on-one consultation. But I think, in what if we like think of a model where like 20 people with back pain are coming in for a back exercise session or educational sessions on body mechanics and stuff, in a place where we are not paying rent and all, but in a place where there is already some social infrastructure that exists, and then we coordinate with them, and then everybody is paying a very little, like, very little sum of money, but then, like, we are covered for the time and expertise we provide, so we get reimbursed. At the same time, multiple people are getting. I think that is a way to go, given the ratio, like, how many therapists we have for every 10,000 Indians, right? Even the physicians ratio itself, probably, like, India is kind of doing well if you really compare to the global graph, in terms of how many providers are available for every 10,000 people or so. But when it comes to rehab services, we are nowhere, 0.000 something, right? So my point is, like, definitely one therapist need to provide care to a lot of people. So we need to come up with a model, sustainable model. And that is also another way, like, say, what I sometimes I think, we can use some religious places to run some educational therapy groups. So that's a space we are not paying for it, and then as long as our time and travel are covered, then we are good. And then the people are, end of the day, they are getting, like, they will value, because only I'm paying this much, but I'm getting some valuable information that's going to help me with my back. Yes. Similarly, we can do a lot of these caregiver training groups, where a lot of these elderly people are being mistreated or ill-treated, or felt like being a burden on the family, right? A lot of these people, like, a lot of people do not know what to do with a person with dementia and their family,
Yes.
right? They're struggling. They like, all we need to tell them is, like, how to, like, first of all, we need to teach them about what dementia is all about, how to keep them safe, how to, like, if they are moody, how to react to them and behave them. That will solve 50% of the problem they are encountering, right? Because, like, they're aggravating it without knowing. They're not doing it purposefully. They love their family member, but they're aggravating that person without knowing what to do. So, like, I thought, but how many of them know that they can pay to an occupational therapist and go and consult them and get strategies and do this? But first, the one barrier is the lack of awareness, which is limiting the access to the services. On the other side, it is the model that we have, Only the people with enough money who can afford services can actually, and they need to have two things. One is money, the second thing is awareness that they can get something from OT. So when both these things join, then they are able to find in a city, they can find a therapist, they can go to the clinic, get consulted. But I think that those are the things that kind of even like preventing us entering into the geriatric practice area. There is a huge need, but unless there is stroke or some medical big disability is there that preventing them physically, that's when we are called upon at this time. But I think we have a huge role play in the geriatric world as well. And also Western culture is influencing a lot in India. There is a lot of like what to say, the assisted living models that are emerging in India. There's a lot of these homes now. In one particular outskirts, they have a big community with 100 homes, and then they have a clinic in the center, and then all these people can purchase or rent a home. The elderly people, they have a community now. So those type of models are started emerging in India. So I think that is also another opportunity for us to be acquainted with them and start providing services in those areas. So again, I'm kind of thinking, like the ultimate goal of increasing the global availability or like countrywide availability of occupational therapists in India is to promote access to services to a lot of people and have them benefited, right? That's what we want to achieve. So the answer is not very simple, but I think we need to take our initiatives on multiple fronts to identify a solution for this issue that we are talking about today.
Yes.
All right, we are at the top of the hour. Any final thoughts that anyone want to share about this topic before we wrap up our discussion today? I mean, even though it's a very small group, I really value each because of course, there are gazillion things to do,
Yes,
but
sir.
we choose to be
Yes,
here
Kavita.
in order to discuss this important topic.
Yeah,
Kavita?
Kavita, you can.
Yeah. Yeah, sir. I just want to add on one thing. With
Sure.
just to club with IOTA or any other NGO, we can try to do camp, as you told, in the religious areas, religious
Yes.
spaces. We can try to start as an initiative to create an awareness as well as to elaborate our service in the rural areas, because in the religious places, most of the people from the rural area and the urban area, they will come and visit that place. So we can try to promote ourselves with the help of NGOs and as well as with the help of IOTA, IOTT or any other organizations, to promote ourselves, like to promote our profession. We can do camps and we can educate the general public what we will do, what as an occupational therapist can help in
Yes.
different areas like orthopedic, like neuro, or as you told, in a pediatric population. So we
Yeah.
can educate the people. So that's what the initial point we can do, because to create the awareness will bring the clients towards the occupational therapy treatment. Because without awareness, because lot of doctors itself doesn't know. Nowadays it's increased, but still they are only from the doctors, the clients are able to know, like, okay, dementia patient can reach occupational therapy, or once the stroke clients got like cognitive complications, then only they suggest for occupational therapy. But in general public, they don't have any awareness that they should go and approach an occupational therapist. So to create that awareness, we can conduct some camps, we can give some pamphlets in that camp, what occupational therapist will do and how they can help in all the areas. So that will help to reach the rural people also. If we educate at least 10 people in a rural area, they can able to they can spread the word to some other people, those who need, like,
True.
they can communicate with the personal group, like if we educate one person, they can communicate with the other person, because if we provide a valuable information to the general public, and it will reach the uh, it will reach more people to get the awareness. That's what my point is, sir.
So I
Yeah.
will add into it. Actually, I was working in Ballari for some reasons. So we are trying to attach to the rural areas. where ma'am has said about the colleges to be emerged in some of the places, like how to we can reach out to the people. The same way I plan for a different model, like reaching to the companies, like some of the companies which are existing in the rural areas, capturing a bigger amount of places, and lot of employees are staying over there itself from Monday to Saturday, and only on Sundays they used to come to the cities because its accommodations is given by the companies itself. For example, I was talking about the Jindal company, which is existing in the near to the Ballari area. So most of our clients are coming to Ballari or from Jindal places where their insurance actually covers all their healthcare services. So what happens is they are actually reaching towards to the Hyderabad. Kavita,
Kavita, could you please
can you?
mute yourself?
Yeah. So Jindal company has a insurance packages, so that they are saying that you can go to Hyderabad or to Bangalore to get the help, and we will be giving the reimbursement for their own employees and their children. So when we reach out to those places as a volunteer to know about the marketing, like how, because most of the people are coming from that Jindal, traveling for more than 1 hour and to reach to our place itself, rather than going to 7 hours and 6 hours towards to the cities. So this was actually giving us a lot of work. Like we can have a collaboration with those companies who are having a population density of their employers, their own children. They can have their own survey, or we can conduct a survey within that companies and try to help them for our services. Because anyway, our need is available. So we went as a multidisciplinary team and provided the win-win kind of a situation, win-win kind of a model. We had a talk with them through the political parties. So it was actually, we are going to have a kind of a camp program on June 17th. So we'll be trying to reach out to nearly around 200 families who are actually having any one of the other, even due to the musculoskeletal disorder or towards to the job related conditions, and even for children with disabilities. So we can reach out to them. Even in every places, I'm thinking like rural places, the companies are existing, like car companies or industrial companies. They are little away from the cities. So those company employees we can able to reach, so that we can able to identify these children and we can help them, because they are not actually in the family. Because most of the time they have to seek the services in the city. So the father will be working there, and he will be sending the family for the city to avail the services and then come back on Saturday, Sunday. So that can be addressed
Mitigate.
in this distribution of areas.
Sure, that's a good thought as well. All right. So, any final thoughts from anyone? All good. All right. So, okay. Again, I want to thank each and every one of you for spending your valuable time here discussing this important topic. Let's hope, again, this recording will be posted to our YouTube channel. Let's hope more people will comment and join the conversation. And definitely, like, in one of our upcoming IOTT meetings, we can discuss about like how to, create some actionable steps towards this initiative. I want to again thank our moderator, Naresh Kumar Karnagaran. Thank you so much. Thanks everyone, wherever you are. Enjoy the rest of your evening, and yeah, please check our website very soon for for the recording. Thank you. Bye bye.
Okay. Thank you all.
Thank you, sir. Thank you, ma'am.
Thank you.
Thank you
Bye
all.
bye. Thank you.
Bye, ma'am. Bye. Bye, sir.